Welcome to Mindfulness Station, the station that can bring the wisdom to your daily life. A very warm greeting to my lovely audience from me. Today is Tuesday, the 27th of July 2021. Before we start our program today, I'd like to lead a small meditation session for 3 minutes. So please feel free to meditate with us. Okay, so that was 3 minutes meditation before we start our program. Right. So I'm very delighted and honored today because with me is Dr. Suthida Suwanvecho, who is Swadika. Yes. So she is a hematologist, oncologist, and palliative care consultant at Medpark Hospital. In other words, she is a palliative care physician who is trained to prevent and ease suffering for people who have serious illness or who need end-of-life care, especially cancer patients at stage 4. She's also been a committee of Thai Plum Village Foundation since 2009 until now. And currently, she is pursuing a PhD in peace studies at Mahachulalongkorn Rajvidyalaya University. She is here with us today as our special guest who come and join us to share and discuss mindfulness in medical field, to discuss things that motivates a medical doctor like her to practice meditation, benefits of mindfulness from a scientific point of view, things that concern palliative care physicians most when they have to help cancer patients at stake for to manage their physical, psychological, social, and spiritual needs, and how doctors nurture their own well-being and many other subjects today that we are going to talk about. It's an insightful conversation, and I believe this talk will bring the wisdom to your daily life, more or less. I appreciate you watching, so please like our Facebook page if you haven't already, and make sure you share our Facebook Live to your friends and followers. And this is me, Dr. Nadnapang Phophichit, and my very special guest. So welcome Dr. Suthida Suwanvecho. สวัสดีค่ะคุณหมอ
Suthida. Good,
Yes,
good evening, everyone, and it is my honor to be here and just share my experience and practice with friends like you. Thank you for
right.
inviting me.
It's our pleasure to have you here today as well. So, first of all, I'm so delighted to have you here and thank you so much for joining us today. We are going to take a mindful moment to talk about mindfulness in medical field. So the medical community has increasingly acknowledged that competent professionals are committed not only to well-being of patients but also their own well-being, right? So medical practice involves working in a dynamic, stressful environment, which doctors have limited times and resources available to nurture their own well-being. So, doctor well-being is reflected by a combination of doctor's physical, psychological, and occupational health, which overall are important for doctors to achieve success in various areas of professional and personal life. And many research studies has shown that mindfulness or awareness arises through the paying attention to the present moment in a stressful practice environment can help increase doctors' awareness of stress and their own emotions and needs. So today, what I want to start with is that as a medical doctor or a palliative care physician, what motivates you to practice meditation? Could you please share with us?
As I was children, I already encountered and with Buddhism when I was young. But the motivation, the most powerful motivation that pushed me to seek and find a way is that when I graduated and I came back to Thailand and I start seeing patients with cancer and I saw their suffering. And with my new technology, new drug, there's many successful treatment for the physical body. However, even that the patient have that better physically, they still suffer a lot emotionally. They cannot live their life. So I feel unfulfilled that I didn't treat the human. I just treat a physical body. So the human have to be include their mental state and spiritual state and everything. So I wish to treat the whole person. So
Oh,
that's why I seek the way. And also at that time I didn't realize that their suffering, the patient suffering, just pouring down on me, and I feel suffer a lot with that
mm,
energy.
right.
So
So
it come to the point that I think that if I didn't find a way, I cannot be in my profession anymore. I have to quit.
right. So that means when you treat a lot of patients, you feel that suffer, right? And it gave
Yes,
you some kind of energy to you that you need to find some way to release those kind of energy, right?
yes, yes,
So this
yes.
is the start point of when you start practicing meditation, right?
Actually, I have the basic since I was young, very young age, like 9 years old. I already practice with the school, with Wat Pawan Nivet, and so I have some basic, but
Right.
that point is the time that I'm seeking teacher.
Mm,
and practice more diligently actually.
right. So this bring you into like deep practice into meditation after you had some basic meditation practice at the age of 9 from the school,
Yes,
right?
yes.
And what are the benefits that you find from meditation that you practice?
Actually, I didn't. I would say that it is a mindfulness practice. Actually, it's not that the meditation in the sense that we have to sit for a long time. That the misunderstanding that we have to sit for a long time. So my teacher teach me to like be aware of everything in the present moment. Aware. It's just like vipassana, right? You have to
100%.
aware what are you doing. Um, uh, like when you talk to the patient, you're aware that you talk to the patient. When you walk, you're aware that you walk. When you waiting for the elevator, you're aware that you are waiting, standing, waiting for the elevator. So that's where it's more practical for me in the daily life. So I still
Mm,
didn't do a lot of the like a formal meditation until I came to MCU and
right.
have to practice the uh, formal meditation.
Right. So you bring the mindfulness into the everything that you do. Let's say that like
Try to,
apply, right, apply, like even when you walk, when you eat, when you wait for something, you try to be mindful most of the time in your practice, right?
yes,
And when you come to pursue a PhD at MCU, you also had an MA in peace studies, right?
yes,
So you have been introduced by the university the meditation vipassana meditation practice, right? So
mhm.
it's more formal way to you.
Yes. Actually, I just realized that when I come to MCU, I just realized that I already been introduced and practiced some kind of vipassana
Mm,
before. When I was teach, I walk. I know that I walk left or right, and I
mm,
practice since I was around 14. So I just walk like that, but not slow
mm,
walking, just walking on the daily life. I aware that right, left, right.
mm.
When I walk, I didn't
Right.
think about anything. So when I encounter the MCU practice, I realized that oh, this is the probably the same thing. And
Oh,
yeah, so I feel very lucky that I go around and then I also find
right.
the same way again. Yes.
Yes. So you didn't know at that time it was a kind of, uh, let's say, the bodily meditation in terms of the four foundation of mindfulness. That was
Hmm.
the bodily practice of walking, right? Walking meditation. You acknowledge left and right of your feet, but you before you even come to be introduced by the practice at our university, right?
Yes, yes. That
Yes,
was I was teach by the teacher at school. I have to very thankful with my teacher, and I'm a very good student. So the teacher told me to do,
right.
I just did it.
So you
Yeah,
just follow without any question, right? Just do
no
it, just
question.
practice,
Just, just
right?
practice.
So if we talk about the from the scientific point of view,
Mm-hmm.
can you please share us the benefits in terms of scientific
Mm.
perspective?
When you aware your feeling, when you aware the feeling that arise in you, then you have a chance of when you aware, you just like that feeling already reduce somewhat, like
Mm,
anger or fear. When you don't know that you fear or anger, that feeling is just going everywhere. But when you
right.
aware, it's just like my teacher said, a mother that hold the baby that
Mm,
crying. So the mindfulness is just like a mother that hold the baby that crying. So your feeling is already reduced in intensity, and that
Mm,
way, in the scientific will, it reduces the exciting stage of like a sympathetic nervous system and a lot
oh,
of bad cytokine. So when you go into relaxation mode, that sympathetic is changed to parasympathetic system, and a lot of bad cytokine um, that cause cancer or cause the cell to be excited stage is reduced. So
mm,
that have the scientific explanation of why you are feeling better and your body also better.
right. So it does has an effect on physical body, like in
Yes,
terms of the nervous system, the SNS and the PNS, right? So
yes,
it helps us calm from the chemical inside our body, from sympathetic to parasympathetic, right?
yes,
For example,
yes,
you said the heart rate and
mm,
the many system in your body become more calm, right, from the
yes,
meditation. Mm.
mm,
Right, and as you are a palliative care physician who is trained to prevent and ease suffering for people who have serious illness, right, especially cancer patients at stage 4 who need end of life care. And what concerns you most when you have to help them manage these physical, psychological, social, and spiritual needs? What concerns you
because
most?
when the patient this when you can use this mindfulness is that when you have fear and you have
Yes.
pain, physical pain, the pain may be like this, but the fear causing the pain to be like this.
Mm-hmm.
So the patient who have fear, they're seeking for more medicine to help, like morphine and a lot of dose of morphine, a higher dose. And even with the higher dose, like 100, say, milligram of morphine, they still feel pain. But if the patient who can reduce their fear or emotion go down, they have
Yeah.
left only the physical pain, true physical pain, and they still need the medicine to help with that pain, but the dose of medicine will not be that high. And of
Mm,
course, when you don't use that high of the dose, then you have less side effect of the medicine as well, and they can rest better and have a better quality of life.
I see. So actually, like how to say, the pain that the patient have, if they have a feeling of fear, it will increase more
Yeah,
than the normal level, right?
yeah.
And if people can manage their own feeling, maybe they can reduce the dose of the medicine that they are given, right?
And also the medicine work better. Yes,
Medicine work better.
yes, because when if you keep increasing the dose of medicine, you end up like knocking the patient out.
Mm.
But if you can manage to give the most effective dose of medicine, then the patient can also enjoy life, can be still awake, talk to their loved one
Right,
when at the
right.
end of life. Yes.
And in terms of psychological, that was in terms of psychological, right? You're talking about fear,
Mm-hmm.
and that actually affects their physical as well, right? When they fear so much at the stage 4 cancer
Yes.
patient,
Yes.
it affects, right? And what about their spiritual need? How do you help them to cope with that feeling?
Because I am a medical doctor, so I encounter a lot of patients
Yes,
in different spiritual
yes.
belief. Okay, but I end up that knowing that they are they need the same thing at the end of life. Okay, I may not expert in other religion, but what I was told is that Muslim, Christian, Buddhist, or even Hindu, the end of life, they ask the patient to be calm by
Mm.
thinking about whatever they believe in the most, like the God, Allah, Buddha, or thinking about, or if they don't believe in any religious, thinking about things that they did in their life that making them feel like a fulfill in the term of like a boon, like a
Ah, the merits,
something like
right?
the merit
Mm.
of that they do something good to other people,
Right. The
and
wholesome
then
deeds
the
that they did
wholesomeness.
before, right?
So when they think about that, their state of mind is calming, and then they feel fulfill, uplifting, that they are
Mm.
a good human being or whatever. They can go to heaven. They can go uh, something. So that what every religion suggests, that you have to calm yourself and think about good things. So the Buddhist
Right.
is also asking to do that. And but the Buddhism have a one step further that I
Yeah.
think that is very key, is that we are letting go. So after you
Letting
think about good things, then you go
let go. Right.
let go. And then if you can do that, probably we learn about the sutra that some of the monks can be enlightened at the end of life. It's the one opportunity also that you can be enlightened. So the
Mm.
Buddhist is looking at the death is not like uh, for the suffering. They also looking it as the opportunity to
Right.
practice. Yeah, so
Right.
that's one thing that I think the Buddhism is really helping.
Right.
Mm.
So in most healthcare providers focus on diagnosing and training illness. I mean, treating the illness. But the end of life care needs a different approach, right? Need a
Yeah,
different approach, like how you help the patient spiritually or mentally. And
mm,
people are facing the end of their lives have to deal with depression and pain, as well as the need for dignity of control. And they also tend to be loneliness. Sometimes they feel loneliness and likely to be more sensitive in those times. So what doctors like concern the most, as you just told me, to help them calm, regardless of what nationality or religions they believe in. Like let them feel calm and think about the wholesomeness that they have done in their life that make them feel fulfillment. And the highest goal of that is to let go, right? Help them to
yeah,
let go at the final state of their life.
yes, yeah.
Right. And so the next question is that before we focus on the question regarding the patients, but now what about the doctors? Like doctors and nurses who provide the treatment to others often face the pressure both from patients and their relatives, right? And are also at high risk of serious infection. How do you nurture and take care of your own mental health, right?
Mm. Yes, the same thing that I ask the patient to do by practice mindfulness. I found that when you practice more walking in the daily life, like aware, in detail in your walk, or the more you practice, you can come back to yourself quicker when you facing the emotion of others that pouring down to you. You can just feel your breath, breathing in, breathing out, calm yourself a
Mm.
little bit, maybe 5 minutes, then you can deal with it again. So
Mm.
um, in that way we can protect ourselves from being overwhelmed, because if we are forgetting and we just doing a lot and without taking care of ourselves, we just like a 100-meter runner, and we're not a
Mm,
marathon runner.
right.
So you have to taking care of yourself, come back to your breath. You can do the formal meditation if you can, maybe 30 minutes a day or something like that if you go that way. Or you can chanting if you like chanting in the morning, in
Yes.
the evening. That's another
Mm,
way of doing the meditation. And also in the daily life you can try to be mindful as much as possible, and the more you practice you can come back to yourself quicker.
right. Like it become more skillful, right? The
Yes,
practitioner have skillful, right?
yes,
So you said that for the doctors and nurses who face the maybe stressful moment from the patients and from the relatives can practice themselves by bringing themselves back to the present moment of the breath, maybe focus on the breathing at the moment or bring mindfulness in what they do at that time, right? And the more we practice, the more skillful we have, right? To bring ourselves back more quickly, the
yes,
more we practice. And even you suggest that maybe do daily meditations for 30 minutes, 30 minutes a day.
yes. And
Right.
also you mindfulness help you to be aware that at that time your feeling is just overwhelmed or depressed, and if
Mm,
you aware of that you can just walk out for a while,
mm,
so
right.
you can be with yourself. So when you
Mm,
aware, suddenly like vipassana, you aware of that feeling, then you know that you have to manage that first until it going down or disappear. So
right.
then you have to walk out and then be with nature or what do or whatever. When you aware that the feeling is better, then you can come back
Mm,
to deal with the patient again.
right. To be aware of the feeling at the moment. And
Yes,
if cannot be with that, if you feel stuck with that, just walk out and change the environment, right? And then
yes,
come back and deal with it later.
yes, yes.
And
Because
that's what, yep. Yes,
uh,
please continue.
I have a example. This is my practice. I just happened to myself. I just like to
Yes.
give you example because I have a patient who I saw for more than 10 years, and she
Mm,
is just like a friend and dear
right.
friend. So when she facing the end of life, when you are close to them, you are more clinging, and
Mm,
and and when the husband asked me that what we gonna do we gonna put the cardiac compression when she arrest, or
right.
put the tube in, I feel like I just realized that I'm doing like the family. I just try to hold on her, and it's not benefit her, it's benefit me because I don't want her to pass away.
Mm,
So I just need the time to be a doctor again and to see if this is really benefit her. So I just asked the husband at the time that I cannot answer this question at this moment. Please give me 5 minutes. I will walk and then I will come back to you and answer that question.
mm.
So this is
That's
what I really do.
right. Very difficult moment for you as a
Yes,
doctor and as a friend, very close friend.
yes.
Right. So,
But it's work. When you walk out, then you have a right, appropriate answer.
right. So you need
Mm.
to walk out from that situation. I mean, just from that environment and take some time to yourself to be
Yes,
mindful and think about what is appropriate to do at that time. What is the
yes,
right thing to do?
yes,
Right. This is the real example that kind of difficult for, I think many doctors have to face this kind of problem to make a
yes.
decision on one's life, right?
Hmm. Yes,
Yes.
that's
And
difficult.
as right. So thank you for sharing about your personal experience that we might never heard somewhere else, right? And in right now that we are living in the pandemic or COVID-19 situation, I think do you find that most of your patients feel more worried about it, like the the cancer patients, do they feel worried that they are in this era?
Yes, they are feeling worried, and not only the patient, most of the people around me is worried. And
Mm,
so I think in the term of environment right now, the energy is fear and depression.
right. Mm. So this situation kind of adds some more anxiety to the patients themselves. Even they know that they are at the stage 4 level of the cancer, right? And this pandemic also affect their mental as well, right?
Yes, because they have to choose if they want to have a chemotherapy. They are afraid that their immunity will go low, and then they
Mm,
can catch the virus easier. And then
right.
if you don't do chemotherapy on time, then their cancer will progress and they may die from the cancer. And many things like they're afraid to go to the hospital because they're afraid that the hospital will have a lot of patients with COVID and they can
Mm,
get the virus, and then they cannot go to they have to go to the hospital because they still need to treat for their disease. So they are in a very difficult situation right now.
right. And does the hospital have some activities to help the cancer patient at stage 4 to, kind of manage their own feeling? Is there
Mm,
any activities at the hospital?
no, we don't, because
No.
the right now most of the doctor is overwhelmed. I mean,
Oh, right.
yes, because they are. Uh, I also have to volunteer for the COVID call the patient at home when they are
Mm,
quarantined at home. They are treated at home for the COVID. So the situation is just like the patient is also in difficulty. The healthcare worker also overwhelmed right now. In and I'm worried for both the patient and the healthcare worker who not practice the mindfulness, that they will burn
mm.
out, and a lot of them already burn out. Yeah.
Right. And can you share with us about your volunteer position? Like, what do you have to do when you call them? And do you have to give them any advice or
Mm.
any like medical advice or personal advice?
Oh, I call them and follow up on them, ask them what the symptom that they have,
Right.
and also I know that they feel fear, and so I ask a little bit, or just try to be. I found that if the person who call is calm enough, then you
Yes.
can transmit the energy of calm
Mm,
to the other end as well. So I like to do that. Um, and the volunteer group that I joined, they send the medicine to the patient who need it, but it may
mm,
take like 48 hours, and not not that quick as they want, but they
right.
still have some help from the medical team. Mm.
Right. So call the patient to follow up their symptoms and ask about their condition, right?
Yes, yes.
And what about the doctors and nurses who work for this? Does the hospital provide some service like uh, ask some, let's say, psychologists to call the doctor and the nurses to cheer them up, to talk about how they feel when have overwhelmed working?
No, actually, I think that is the terrible situation that we have in that uh,
Mm,
we have to try to taking care of ourselves. Like a friend
right.
of mine who never saw the patient die, and a lot of doctors who not in the palliative care, so they not familiar with the patient dying, but they try to help. They volunteer to help, and they try to help the patient, calling ask for the bed and to other hospital, and then she got the bed and she called the patient, and the doctor said that the patient is already passed away at home.
Mm,
So this doctor, I'm worried about her. So I asked her to stop volunteering for at least 2 days, being
mm,
with herself, relax,
right.
because she will have the post-traumatic stress disorder from this event, because she tried to
Mm,
help and it's not successful. So
right.
a lot of things going on that the patient need help and the doctor also need help.
Yes, the doctor also need help psychologically, right?
Yeah,
To because they the like how to say very important people to help other people maintain their physical condition and psychological condition as well. But now doctors have to take care of themselves. Like you just said, you have to help another doctor to uh, take care of their mental health by not uh, directly working after some case happen, right? That
yeah,
would bring her down,
yes,
right?
yes, yes.
So, in this situation, I believe that many people are watching our Facebook Live right now. They might want to hear some advice from a medical doctor. Do you have any suggestion or advice at this moment of the pandemic 19, COVID 19?
Okay. I think everyone have fear, and the fear is not wrong, because you don't feel guilt that you fear, and don't try to be brave, like going
Mm,
out without protection. So the
right.
fear is there to protect you, but also aware that uh, that the fear is there to protect you, but you not let yourself to be overwhelmed by the fear. Just try to whatever you do, you can follow your breath, or you can chanting, or you can drawing pictures, whatever you do that can help you to relax in this pandemic. And 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 whatever you do that, yeah.
Yes, I'm sorry. Yes.
Yeah. So that help yourself to calm down, and for me it's breathing and walking. So for you, try to find the way to be to help you relax, and
Mm,
uh, and anything happens, then you take a breath. If you got COVID, you take a
mm,
breath and calm yourself down first, and then you have a clearer mind what to do, what is the number to call, and what medicine to take. If you don't have the medicine from the medical professional, you may have the fertilizer and all these things, so you can take it, something like that. So when you face this serious situation, mindfulness is the very, very important. Yeah.
right. So I think most of the those who are listening would get a lot of benefits from our talk today. Like in this pandemic situation of COVID 19, fear would be the factor that bring anxiety. Like and not to be too brave to go outside without any protection that will lead you to mindless, not mindfulness. And also, if some of you are infected, just follow the advice that the doctor just gave you. Be mindful, take a deep breath, and look for what number you should call, what medicine you should take care of your mental health. Right. And right now, I think some of the audience who are watching our Facebook Live might have some question. So now we will shift to see the question from Facebook Live. To the audience who are listening and watching our Mindful Station right now, if you have a question to ask our guest, who is a doctor, regarding the mindfulness in medical field, please feel free to do so. Right. So let's see. Do we have any question from Facebook Live? Okay, so uh, we have a question from, I believe this is Myanmar monks. Thank you very much for your speech. Honestly, I would like to ask the question how to apply Buddhist methods in the pandemic with coronavirus. Right. This is the question to you.
Actually, I think it at this way. When you are mindful, like when you, it is also the opportunity to practice mindfulness, like you aware all the times that your hand touching something, right? And then if your hand touching something before you touch your face, you have to wash your hands or use the alcohol gel to, so you aware all the time that what your hand touch, and then before you doing anything to your face or eating anything with your hands, then you wash your hands. You aware that when you wear the mask, uh, that the mask is covered, and then if you have to take the mask off, you don't put the mask in the desk, on the desk, without protection, because the desk may be dirty, right? So you know that the mask have to be clean before you put it back again. So it's just like this little thing, like you aware when you going out, then you come back to the house, then the first thing you do is to take a bath. So you know that you clean yourself. So it's kind of, this is the Buddhist way of practice mindfulness anyway, in the practical form. But the more that you aware, then you can protect yourself better. And however, even if you aware of everything, and then in some situation, then you get infected anyway, and it's not your fault. You aware and you try your best, but you still get the infection. Then that practice of letting go, that okay, I
Mm,
do my best, but things still happen, then let it go. That you don't need to blame yourself or not to be angry. Now mindfulness, that mindful that I'm sick, and then how I'm gonna taking care of myself, and not just dwell on that why I get it, that I protect myself the best, but why I still get it, something like that. So this is all the Buddhist practice, I think. Awareness, letting go, be relaxed. Thank you.
right. Yes. So hopefully, Venerable, you are still here with us and heard the answer from our doctor today. Right. And next, do we have another question? Let's see. If we get if we get COVID positive situation, how to control our mind for peacefully? Yes. For those who are infected with the COVID-19.
Yes, when you get infected, then you have fear. Like it's just, I look at the same things as when you get the news of you have cancer. So your mind initially will not be at peace. You're just aware that it is not peaceful.
Mm,
Yes, and you don't need to be at peace right away. When your mind is not peaceful, then you aware that it's not peaceful. When it have fear, then you aware that it fear is there. And I think gradually when you aware like that, I think our teacher said that when you aware of it, then the intensity will go down a little bit, and you can stay with it longer.
mm,
And you don't need to get rid of it right away. Don't try, because that is the, you cannot get rid of it. But
mhm.
if you aware and you stay with it, then you at least have some peace in your mind, and you know what to do more rationally, I think.
Right. So if we are getting the positive from the COVID-19, the positive result, uh, first thing, of course, the mind is not peaceful. So
Yeah,
be aware that the mind is not peaceful and
yeah,
try not to be peaceful at that moment because it's gonna cause the anxiety or make you feel stressed, right? So it's okay to acknowledge not peaceful state of mind, right?
yes, yes,
and then when you come, you can manage your feeling after that, right?
Yes. Yes.
Okay. And do we have another question? Let's see. Okay. Right. So most of the question are related to the COVID-19 uh, as right now we are talking to the medical doctor, and so people are concerned the most at the moment is how they can be safe from the situation, and if they got infected, how can they manage their own feeling or nurture their own mental health in a good state, right? Okay, we have another one. I think Kayanupassana is the best way to get rid of fear of COVID. Right? What do you think? Uh,
I agree too. I think that you can do Kaya Nupassana, you can do Vedana Nupassana. Actually, you can do the both for. It depends on how you like or you are skillful in which practice. I think that you can do either four of them. Yes.
mm, so there's four foundations of mindfulness can be applied here. Like not just
Yes.
which one is best or which one is not good for the situation, but we can apply the four foundation, right?
Yes. Yes.
Okay, let's see. Uh, okay, now, all right. This one I think we have. Okay, another question from Myanmar monks. Excellent for your speech. I wish you the best. Answer to that question. Do you think mindfulness can help us without fear and worry about COVID-19?
I think the fear will be there. I think that it's gonna lessen somewhat until we become arahant. So when one time my sister asked me that I if I fear of death and if I still fear of death, how can I tell my patient not to fear of death?
Mm,
So I realized that I need to work with my fear. And I can now tell my patient that I'm still fear of my own death. So, but I'm honestly tell them that I'm still fear of my own death. But I will try to help you as much as I can. And we'll go together through this fear together. Because I am not arahant, so I'm still fear. So I don't believe in get rid of fear uh,
mm,
at this stage of human being until we practice in the higher level. But I think even if we not that level yet, we still can help each other to ease the fear and go through this together somewhat. And we, if the times come that we have to face death, we can be at least calm. That's
right.
what I hope for myself and others.
Right. So fear will be there. Fear will be
Mm-hmm.
there. But we don't deny them. Even for the doctor themselves, admit, right? Admit the
Just
fear,
admit the fear.
admit it, and then help the patient by calming that feeling and tell them that we go through them together, right?
Mm-hmm.
And the next question, how do you see the ancient medicine method? Example like Indian Ayurveda, Tibetan medicine, etc., against the COVID-19.
Uh, I understand that you're talking about Ayurveda, right? And the Tibetan medicine. I think there is some wisdom in uh, this treatment, in this kind of medicine. And but because the COVID is a new thing, so we don't know what working and what not working. I think that Ayurveda and Tibetan medicine also have some wisdom, and
Mm,
actually it can treat the symptom. And I think if it doesn't bring harm to the body, I'm not against it at all. I think that you can use it because, to be honest, I think the Western medicine don't know what to do either at this
mm,
moment. They're still learning as well. So why not? But
mm,
of course, you have to know that what herbal medicine, how it work, and it not take too much, and you have to be with the true doctor of that that expertise as well. Because I was told thatฟ้าทะลายโจร you should not just take it as the prevention because it cause the the um, coolness in the body or something like that. So
mm.
you
Right.
have to get the advice from the the herbal medicine doctor as well. So because I'm a Western doctor, so I don't know a lot about the herbal medicine, but I'm not against it at all for the treatment of the COVID.
Right. So this probably a clear answer from the doctor's point of view. Ancient medicine and Ayurveda, from the Indian, can be used if it's not harmful to the body, and but make sure that you know the effect, right? The effect of
Yes,
that medicine, right?
yes.
Before use, right? And so, one last question for today. Do we have a lucky person to be chosen for the last question? Let's see. Okay. Uh, is the body decide to heal itself from disease, especially COVID pandemic?
Yes, the body decide to heal itself. You can see that the young people, they don't have a lot of they have been sick but they're not dying, so the body can heal from this COVID. The problem is the older patient, the older, and have the many disease in their body before, so they is the most vulnerable to get sick and die from the COVID because they are not strong. So the body itself can heal, but also there is a vulnerable population that need help, like need the vaccination and needs
Mm,
medicine because otherwise they cannot go through it.
right. So the body does design to heal itself, but for those who have high immune system, right? But the
Mm.
old people and young people need vaccine to help them create the higher immune system, right?
Yes.
Okay. So now we have come to the final part of our program. So please let me conclude what we have discussed with our special guest so far. Palliative care is a whole person care that relieves symptoms of a disease and provide comfort and improve the quality of life for anyone who has a serious illness. And the palliative care physicians focus on treating people holistically, let's say both body and mind, and improving their quality of life by managing pain and other symptoms. And cancer diagnosis often affects the emotional health of patients, families, and caregivers. And the current coronavirus outbreak may add even more worry for people with cancer. And what concern most to help them is what concern most from the doctor's perspective is to help them calm, regardless of their religions, what they believe, what they have faith in. Just let them think about the wholesomeness, the wholesome things that they have done in their life, and the things that make them feel fulfilled. And finally, help them to let go of those feelings, right? And the scientific evidence has shown that mindfulness can help relieve stress, treat heart disease and lower blood pressure and reduce chronic pain. Like it help shift from the SNS to PNS, like the system in the body, nervous system in the body. And the mindfulness is the practice of purposely focusing of your attention on the present moment and accepting it without judgment. Mindfulness is now being examined scientifically and has been found to be key elements in helping people, including doctors or patients, to be in a good mental health. So today we have an insightful conversation about mindfulness in medical field with our special guest today. So now I would like to express my sincere thanks to Dr. Suthida Suwanvecho. It's a pleasure and an honor to have you here today. Thank you so much for joining and sharing your wisdom with us. Thank you so much. ขอบคุณค่ะ
Thank you for
Yeah.
inviting me and hope that I can be helpful. And thank you for the audience that support our program นะคะ Thank you ค่ะ
Thank you so much. And thank you, the audience, for watching. And thank you for every comment and like and also questions. See you again on Tuesday night at 7 p.m. And what is going to be our next talk and who is going to be our next guest. Don't miss our program. If you like our Mindfulness Station program and you think this Facebook Live is beneficial to you, please don't keep this to yourself. You can support our program by sharing this video to your friends and expressing your thoughts below in the comments. And make sure to follow us on Facebook page so that you don't miss our interesting talks every week. Today, I'm Dr. Nadnapang Phophichit together with the Mindfulness Station team have to take a leave for now. Thank you for watching and see you again next Tuesday. สวัสดีค่ะ
สวัสดีค่ะ